Hi, Victoria here. And hold really strong. Knuckles to the sacrum and round the beautiful iliac crests. Lovely. Massaging and stretching and a flick. The correct direction from the ileocecal valve here up the ascending colon. Pressing the hand down firmly for grounding, rooting, creating that beautiful connection to the earth. Stretching over the trapezius, that felt better. And pulling a little more to the back. Oh, you've got a tear. Hi, Victoria here. Welcome to the channel, and today I'm going to be massaging lovely Mandy. You've seen Mandy before for a core therapy, so I'm just getting ready for a 2-hour possibly massage of full body, face and scalp, and getting my hair back this time. Maybe a couple of grips. When she's here, we're going to be doing a little kinesiology, working out which essential oils to use in her treatment. And then we're going to pick a card and see what resonates with her today. It's first thing on a Monday, so I'm going to be choosing my own card for this week as well. So join me. Thank you for all your subscriptions, your likes and your shares. Please do send me a little cuppa if you want to support the channel even further, or a super thanks on the YouTube swipe. And on this channel you will see all manner of backgrounds and conditions, all manner of body shapes and sizes, because that is the real world and that's what I want to show you. This is a real clinic, real people and a real therapist. That when you look on YouTube yourself, you'll be able to look for whatever's concerning you in your life, and hopefully there might be something that you can resonate with one of my clients that comes and visits me in the bothy. The amount of clients who come to me and I see real benefit with their treatments, they go away feeling so much better, and that is why I do my job. I absolutely love this role, this vocation I have in life. Being able to share the treatments with you on YouTube really helps my clients to be able to talk to you guys about what's bothering them, be it anxiety or a physical issue or headache, backache, or even as severe as things like cancer and trauma. If you want to like and support me, please like the videos, share them around, and also send me a coffee or a super thanks in order to support so that I can go on to do further. Thank you very much for all your support. Love you lots. Let's spread a little healing from Victoria. So lovely, Mandy. You are here for another treatment. You're having a massage today.
Please.
Yeah, please. When was your last massage?
Gosh, that was probably just something I had when I was on holiday somewhere. I haven't had a proper good massage for a long time.
Okay. So we're doing the full body and a face and scalp massage as well. Yeah, lovely. You will be in heaven. You will be so calm and relaxed at the end that let me bring you round, because you won't want to suddenly come out of it. It's a nice place to be. So just let me bring you round.
I do
gently.
think I will probably fall asleep.
Oh,
yeah.
Nice, lovely. Okay, so before we do that, if we could pick some essential oils. Now then, you were just mentioning about your hip that you probably talked about on the video last time, actually, before the core therapy. It's your right hip, and you were just saying the MRI showed that the femur, so the very top of the leg bone, has worn away a little. Yeah. And also there's some bruising on the iliac, which is the bone around it, of the hip. And you're having an injection, a epidural, did you say? Not an epidural, because that's in the spine.
Yeah,
a cortisone injection on Friday, so in a few days' time, in order to reduce the inflammation.
Yeah, I think it sort of settles everything down for a while. It's not a cure by any means, but it's a way for the consultant to see if it does relieve some of my symptoms, then he knows what to do about it.
Yeah, okay. Let's choose some essential oils. I'm just going to get my glasses. So I'm bearing that in mind. Anything else I need to think about? You said you didn't sleep well last night. That was because of pain levels?
Yeah, that was discomfort. So in terms of me, that's sort of like it comes and goes. Sometimes I fall asleep straight away, but last night was difficult. It might sometimes be related to things that's on my mind because I have got worries with parents at the moment, so that's playing on my mind too.
Okay, all right. So just a little bit of sleep, but mainly the hip. Anything else?
Nope.
No, lovely. Okay, so I'm mainly going to go for muscular and anti-inflammatory oils. Of course, it's the middle of the day here, so you don't mind me using sort of more stimulating oils? Is that okay?
That's fine.
Even though it's a relaxing treatment, but it would be nice to boost the circulation a little bit to that area and the white blood cells. So I'm more thinking of rosemary and, well, in a more sedative way, frankincense. So more stimulating, I'm looking for black pepper.
Ooh, my favourite.
Yeah.
Put black pepper on everything.
Ah. You know, I had a food allergy test done recently and black pepper came up as amber. You know, it's a red, amber and green. And
Yes.
the amber came up as peppercorns. So I've got to be careful with them.
So is that something that changes over time?
It can do, but not much. Not with blood food allergy testing. It probably doesn't change that much, actually.
Okay.
So I can reduce the amount of pepper I have.
Yes.
But you know, it's very difficult to take pepper out completely from your diet. It's going to be in everything that you eat outside the home. Right, ginger definitely. That's more stimulating. I am actually thinking of clove, very stimulating and analgesic. I'd also like some chamomile because that's highly anti-inflammatory. So we've got the German chamomile there, Roman chamomile as well, two-pronged attack. But we're going to kinesiology them, and other things might come up if these ones are no-nos, maybe cinnamon as well. So, okay. So let's start off with a test. If you could put little finger and thumb together, I'm going to try and pull apart. Just turn a bit more this way so the camera can see the finger and thumb. And hold. Right, really strong, okay? So in the other hand, can you hold an oil touching it to you? I'm going to come back to this one and hold. Ooh. I had a feeling that was going to fail. I don't know. I just had a sense about it. I thought this isn't going to be good. And hold. Really strong. So how interesting. Roman chamomile, no. German chamomile, yes. German chamomile is even stronger, and it's a particular scent. Not everyone likes it, but I will be putting other things in with it. And hold. Oh yes, okay. Frankincense. So we've
yin and yang.
Yeah. So we've got a mix there because they're both anti-inflammatory and relaxing, but they come at the problem from different ways.
Oh, I see.
Yes. So chamomile is highly anti-inflammatory. Frankincense is more sedative. And frankincense on the side is also really good respiratory, which can help us with sleep.
Yes.
Am I detecting a little bit of a blocked nose, or have I got that wrong? Are you slightly blocked at the moment with your sinuses?
Do you know, yesterday when I could hear myself talking, I thought, I sound different, but I don't feel blocked up.
Echoey, yeah.
Yeah.
When you first arrived, I thought there's a tiny bit of a blocked nose there. So frankincense has come up as a positive for you. Your body knows what it needs.
Yes. Yeah.
Okay, hold another one and hold. Okay, no strength there at all. That was cinnamon. and hold. Not brilliant. And just to you.
Oh, yes.
And hold. Okay, just about. So rosemary, which I was hoping would be good. And hold. Yeah. Black pepper. And hold. Okay, that was strong. So we've got a choice here. Last one. And hold. Okay, so now the taste test, if you like, or the scent test. I'm going to ask you to smell each one, and then you can tell me which your instinct, your intuition goes to.
It's a strange smell.
That's ginger.
I can taste it now, if you know what I mean.
So can I. It's in the air. Very strong. You're not keen.
It's clove, but
Yes, it's clove. Yeah.
it's nice.
Yeah. Okay. So that's the black pepper. So rosemary.
Oh, yes.
Yeah. Very
I'm going
good.
to like them all, that's the trouble.
You weren't keen on the first two, I don't think.
It's nice.
Okay, frankincense. Last one. That's the one people aren't keen on. Yeah, but it's highly anti-inflammatory. So, shall I decide for you, or do you want to choose?
I'd like to try the German one because it was strong at the beginning. And I like the idea of the frankincense. And I'll let you choose any other.
Okay, let's pick another two. So I'm going to go for rosemary. And so let me think, we've got two base notes there and a top note. So maybe we bring in a middle note as well, then we've got a balance.
Which one's that? Is that the ginger?
This is black pepper, and
yes.
rosemary, and German chamomile and frankincense.
Smashing.
So anti-inflammatory, sedative, stimulating. Well, these are both stimulating, rosemary and black pepper.
Yeah.
But they're very good circulatory wise, so they will boost the circulation. Your back, when I'm doing the massage, will go nice and rosy. That's what I want to happen. I need an even spread of that lovely rosiness. Yeah, so
Okay,
I think
go
that's
with
a good
those.
mix. Right, before you go, let's pick a card.
Ooh.
So you choose any, have a delve. This is your card for the week. And turn over.
Caring.
Oh, do you want to read it out?
Seeing with depth and really understanding the connection and responsibility we all have towards each other. As a master, I act with a full and open heart, even if it takes extra time and takes me out of my way. That is very apt at the moment, and I'll tell you about that later.
Okay. Of course, you mentioned your mum and dad, so caring. You're very much a carer.
Well, that's what I'm going to be next week, because Mum's having a break, so I'm going to go and live with Dad for a week.
Oh, well done. How lovely. So are you working that week as well, or?
Work has been fabulous because I said I'm not going to be able to work full days, that sort of thing, so should I take some unpaid leave? And they just said, work what you can and make the hours up over time.
Oh,
So they've been caring too.
yeah. They couldn't say any better than that,
I
could
know,
they?
yeah.
Oh,
So,
nice. And it'll give you a good perspective on what's going on at home.
That's exactly
what your mum is dealing with most of the time, and also, you know, some lovely care, father to daughter.
Yes, yeah. So
Right, I've just picked mine. Being a Monday, I haven't chosen mine yet. I've got enthusiasm.
Woo! Smashing.
Well done reading that without. Have you got lenses in?
I had lens replacement 4 years ago.
Oh, you don't need glasses anymore. Oh, amazing. Enthusiasm. As a master, I see the fulfillment of my destiny clearly. Success is my right, and my eyes do not stray to the temporary setbacks along the way. Seeing the end goal with enthusiasm.
Absolutely.
So there we go. If you want to put your card down, and And I'm going to put these in a mix. German chamomile is blue, a strong blue colour because it contains azulene naturally. Okay, so if you want to bring your arms under the towel so the hands are warm, and I might now when I come to do the face and scalp massage, do you want me to wash my hands before I do the scalp or not? How are you feeling? Yeah, okay. So just for now, I might just put a little flannel to just keep the hair from bothering the neck. Is that all right like that?
Perfect.
Yeah, okay. So oil going on. It's a beautiful dark green colour because of the blue of the azulene in the German chamomile. Mixed with the more yellowy of the base of the organic sunflower oil. Lovely. Oh, it's just so moisturising. It's nice and coating. Be really good for your skin health as well. And of course, sunflowers contains many vitamins and minerals, so those naturally soak into the skin. My skin's quite dry. I'm finding I'm needing a bit more oil. That's better. Oh, lovely. Okay, just relaxing the elbows out, just bringing the hands in, that's it, lovely. Okay, Mandy, 3 nice long breaths. How's the pressure so far?
No, that's absolutely fine, thank you.
Good. So, Mandy, this is your time, no one else's. You're giving yourself the gift of a massage and that time just to completely relax, recalibrate, and accept some healing. The beautiful essential oils, and we've chosen 4 of black pepper, German chamomile, rosemary, and frankincense. So we've got some big hitters there, the beautiful oils that will help look after you. And of course the card you've picked today is caring, and these oils are caring for you. So take yourself somewhere utterly beautiful. Whether that's a beautiful sandy beach, the top of a mountain, a wonderful fresh forest, or simply a comfortable armchair that you're familiar with. And you may well find your mind drifting to various active and busy thoughts at points during the treatment, and that is absolutely fine. And simply stand back from those thoughts as if you are a bystander and observe them arriving, passing through and leaving. And know that you can address those thoughts, if needed, at another time. And for now, this is your time to rest and heal. Bringing your awareness to some nice long breaths. Feeling the oxygen circulating via the blood through the whole body. Massaging deeply each side of the spine. So at first I am simply checking out the whole back in order to find out which areas need more attention. Thumbs strongly to the sacrum. Following with knuckles. Knuckles to the sacrum. And round the beautiful iliac crests. To the sides, where it can feel a little sensitive. And having heard about some wear and tear and bruising to those bones, then they will be helped with stimulation and bringing some more blood flow to the area with massage, but also with those lovely essential oils, especially the stimulating ones of rosemary and black pepper. And now bringing that circulation up strongly each side of the spine with long thumb sweeps. The beautiful channel that is naturally there in between the erector spinae lengths of muscle and the spine itself. Into the neck. Following from the sides of the length of the back, the spine, and then up the sides of the cervical spine around the neck. And then alternating thumbs. Clearing the way so that the red and white blood circulations can move effectively. the shoulders, shoulder points, deltoids down the lateral edges of the scapula, the anterior up over the trapezius. Scoring that lovely edge of those angel wings, clearing the toxins so that the shoulders can move more smoothly, more effectively. And then over the adrenals. The kidneys. The kidneys responding well to being warmed with that knuckling massage, and then just above them to those adrenals to help the body cope with fight or flight and any stress response. Reverse effleurage, always strongly up to the heart, gently down, strongly round the hips and up. Pushing the shoulders down. Going nice and rosy now. 2 fingers each side of each vertebra, just pressing in line with the breathing, just at the level of the discs. Clearing the way, creating some space. Enjoying the rhythm and the pace of beautiful breath work to the spine. And then clearing down the same channel. nice and warm, rosy. And then stimulating upwards in 3 swathes around the hips and waist, around the ribs and the scapula, and over the top of the shoulders. And then to the waist, the obliques, pushing down, really good to help balance the immune system. At this point there are key lymph nodes stretching down the sides of the torso. The oil has gone in beautifully. Smells amazing. And coming back up to those shoulder blades, knuckling over the top of the bone itself, agitating any impurities, toxins that are sitting there on that flat plate of bone. It feels good to have that agitated and moved. And then around the edge of the scapula once more. And picking up an arm. Lovely. Just raising that shoulder blade so that I can hook underneath the scapula and access even more of those remnants. Get them moving up and over the shoulder to the cervical lymph in the chest. Some nice rosy lines starting now. It's a good sign. Show the body is responding well. Knuckling again. And then bringing the arm out. And up and over. That's it, relaxing it down. Pushing the fingers up in order to isolate the scapula. Right. Coming out. Shape to relax. And back under. A bit more oil. Beautiful glazed greeny colour. Around the shoulders, including the arms. now some beautiful rib work to clear the impurities that sit nicely between the ribs. They sit there very happily until agitated in this manner all the way up. Lovely, now the warmth is coming in, the rosiness is spreading, and we clear any that have been agitated, risen to the surface. We clear them back down to the sides of the torso to go into our waste factory and out. Leaving some beautiful red stripes. A line of fingers all the way to the lymph node under the armpit. And then swathes, overlapping hands, starting in a stimulating fashion, out, clearing that line, the edge of the spine, and out, shoulder, arms, torso, hips. Encouraging the length of the shoulder across the top from the neck down the arm. And then more slowly, bringing the body back to a settled state. Back to the effleurage. Having smoothed over the aromatherapy oils over the whole back of the leg, hip, and the foot. And now I'm going to concentrate on the lower leg, calf, the Achilles, up to the knee without putting pressure on the popliteal of the back of the knee. And I'm feeling into the calf muscles, seeing whether they're able to soften and give. That's good. Doesn't feel like there's too much standing. And some people I treat, the calf muscles are quite solid from a lot of standing and walking, so they're able to give. So I'm applying more pressure at about this point where the calf muscle splits, and toxins can sit quite happily in the V of that split for years. But once you're able to split that calf and massage it upwards towards the heart, that's it, just relaxing it, then you can shift those toxins, get them moving into the lymph and out. It can feel quite sore here at times, and it's not feeling too bad to me. And down, and then into the Achilles. Moving it each way, bouncing, rotating it left to right. It's like a swinging action, making sure that there is some give, it's not too stiff. And then all the way up the leg, bringing some strong pressure to the outside of that upper leg, femur, which of course this is the femur that has some deterioration. So we're just wanting to bring some really good circulation to this hip and leg. And a nice caring, therapeutic massage to the very top of the femur. Now using 2 whole hands. And then from the bottom of the back of the leg, some 3-finger stroking, which allows just the right amount of pressure onto the lymph. Get it moving gently over the back of the knee. Nice flat fingers. And then hooking under that bone, the sit bone, including the foot all the way up to the thigh and hip. And a bit of knuckling there, creating even more heat. And then an effleurage upwards, spreading that warmth. And nice and rosy there now. That's good, that's what we need. So spreading that lovely oil over the back of the left leg. As a therapist, you can almost see the healing properties within the oil and the essential oils, finding their way to the places they can help the most, be it the circulation, the lymph, or one of the vital systems of the body, the organs, the skin. All the oils are like friends going about their business, finding the places to help and getting on with their work. And the leg is lovely and warm. Circulation now stretching down from the heart all the way to the toes and the whole foot, coming up over that beautiful calf and around the left hip. Feeling into the calf, coming up, separating those muscles again. This one seems to slip lower down, it's interesting, and more to the anterior side. Some rosiness coming in there now, and raising the foot, just letting it go, and then strongly down so that gravity helps me to move the remnants and impurities that a massage is so good to help shift. And down, back to the Achilles, swaying it from side to side, bending that lovely soft fascia side to side, and pushing it down strongly up, careful over the knee, and then having a look at the back of the thigh, the hamstrings. And over that iliac. Strongly round the side of the iliac crest. And a little knuckling. finishing off with a lovely effleurage. Effleuraging to finish. Nice and strong. Okay, starting off by giving the leg a little stretch. And then lovely over the foot. Strongly up the shin. We've got some nice tummy noises happening now. Mine will probably join in a minute. We'll have a little orchestra going. Okay, so each side of the shin bone. Tracing a line, almost tucking underneath them. Coming under. Lovely. And then over the knee. Just introducing the touch and the oil at first. And then again, just like with the tibia and fibula of the lower leg, just trying to hook underneath the patella. And then, just like with the Achilles, moving it left to right, see if it moves, and up and down. And then down, left side, anterior, again pushing those toxins to the back of the knee like you do with every massage. You're always conscious of where the lymph nodes are that will then secrete those excess dead skin cells and toxins and free radicals away, giving it a little stimulation, bouncing it, and then hooking over the front of the thigh, the quads, hooking them up and swinging them over, seeing how they are. Bringing some warmth here. Let's get them, the thigh warm first. Lovely, it's gone nice and rosy now. Perfect. And then strongly up. Of course, this is the hip that's been concerning, so just bringing that circulation from the leg up to the hips so the lymph in the pelvis doesn't have to work so hard. And then around that hip bone. That's good.
Certainly worse.
Sorry?
Certainly worse.
Oh, good. And turning the foot to relieve the ankle. Massaging around the ankle bone, clearing from behind, bringing some warmth down here and to the front aspect. And then between those metatarsals, very long metatarsals, easing the tendons here. They're quite strained, soothing those tendons. So the frankincense will help here in a sedatory effect, calming those tendons. Also the German chamomile anti-inflammatory. And then a lovely massage underneath the foot, securing back of the heel, and then a knuckle under where we can get tightness, for instance with plantar fasciitis. And then the instep. And of course, reflex-wise, this is helping all the digestive, urinary, excretory, a little bit of the endocrine. So much going on in this soft area. And then up into the respiratory of the foot pad, the toe pad. And then spreading. Some acupressure points. To the neck. Rotating, relieving the neck. That's it, freeing it up more, letting it go. And then a flick. Rotating, massaging and stretching, and a flick. So again, strongly up the shin, having introduced the oil, and had a check on the whole leg and foot, seeing where needs attention, giving the leg a little stretch, up and a stretch, lengthening the muscles, relieving joints, a little wobble, and then hooking under those beautiful bones again, just like we did on the right side. And pushing the lower leg down into the couch, letting the thick, soft towels, blankets underneath just take the pressure and help relieve the calf at the same time. Then onto the beautiful knee, again hooking under that bone, rocking and gently swinging the patella side to side, pushing toxins down. And back to the patella. And then to the lymph node underneath, just bouncing it a little before hooking under the sartorius, and swinging it over the top to the lateral side, bringing, like bending that muscle over. Lovely. That's wonderful. And then pushing up the side, rolling the leg in, so that all the leg wants to do is submit. And then up to that lovely iliac again, and allowing the leg to relax. And then round the iliac all the way up to the crest. And a good knuckling again. Nice and warm. And bringing the energy back down to the foot. Connecting with the soul, knuckling into the pad, instep, heel, and then round the edge of the foot. Quite tight along here. This is reflex-wise, this is the middle of the spine, thoracic, lower thoracic, and then up around the neck. finding any protrusions, so bones that may be misaligned or sore, and just giving them a little extra attention. Areas of cold or overheated, so a little cold around here, it's warmer now, and then the neck, it's obviously a bit sore there, so massaging into the very base of the big toe and all round it, so the inside, the back, outside, so that the neck will feel less strained, calmer, and then a good rotation. And a stretch, a massage and a flick. Massage, a rotation, a stretch, and a flick. Sending the foot some love. We have a purple theme today. Purple towels, couch cover, nail varnish, and fluffy socks. And a lovely heat pad to the shin and foot. Bringing some warmth to the area. So just applying the oil to the abdomen. And effleuraging the soft tissue in between the bones of the ribs and the iliac crests. Each effleurage applying a slightly stronger pressure. And then bringing the fascia from the side of the torso up. And this has an effect of helping to relieve any strain or pressure, tightness across the front into the skin and fascia, but also the organs contained within. It helps soothe the back as well, because of course the back has already been massaged and treated with oils. So it's an extra back massage. Bring it around the sides, the obliques, and then over the lower ribs, the obliques and hips. Back to the effleurage. Slowing down. And then a double circle. Circle within a circle. Coming round, feeling with flat finger pads over the colon, the correct direction from the ileocecal valve here, up the ascending colon, across the transverse, a little bit of tightness there, and then down the descending, softly over the lower abdomen, and then clearing the ICV, the valve, gently in the correct direction from the small intestine to the large and up. And feeling under the left rib now for the stomach, spleen, pancreas. It's going nice and rosy, lovely. That's the intention. Helping to soothe them, helping them wake up and work. And the same to the right. The main organ here being the liver, but also the gallbladder. Again, nice and rosy. And then calming the anxiety point. And the Ren, Chinese meridian. And then alternating hands again, following the flow of the colon, up, across, and down. This helps get the digestion moving, but also because the kidneys are here with the adrenals just above, helps the health of the kidneys, helps them to filter and flow so that they can filter fresh water once given water after the treatment. And then low down into ovaries and very gently over uterus and bladder. Coming back to coming up for some energy work. Beautiful energy creating some space. And down for that lovely effleurage. Before finally connecting with acupressure points. Pressing the hand down firmly for grounding, rooting, creating that beautiful connection to the earth. And then strongly up towards the heart. That's it, bending the elbow, resting it down, bringing the oil to the forearm. Two strong thumbs in the channel, in the very centre, repeating that lovely action all the way to the lymph node in the elbow, and then giving it a little acknowledgement, a little press to get it working and stimulated. Lovely, some nice rosy lines appearing now, that's what we want. And seeing the tendons in the fingers move, just naturally curling as they're pressed. That's good. And then strongly up the outside of the forearm, elbow. Bringing the hand, bent elbow, securing it at the other shoulder, and then a palm rotating around the elbow bone and up, so allowing the upper arm to be at a right angle to the couch in order that the gravity of the arm helps the flow of toxins back down to the armpit, all the way down, nice and rosy. Then around the shoulder, all the way to the neck. Picking the arm up, giving it a little stretch. Letting it go, letting it go, nice and loose. And then a couple of clicks, a little wrist rotation. Let's get rid of those clicks. So I'm pressing where I felt the click, then I'm continuing the rotation, applying enough pressure that it's not hurting, but it's just a nice softness, helping to relieve any spasm causing that click there. Yeah, it's going now. Lovely. And then a massage into the joint, deep into the gully there. There's a line in between the hand and the wrist bone, and then underneath. And a massage, a stretch, a rotation, and a flick. In between the metacarpals, lengthening the finger around every knuckle. And the palm. I'm going way over time, is that okay with you?
I'm loving it.
Oh, good. Okay, so having introduced the oil, now anchoring the hand to the opposite shoulder and bringing a strong palm down the upper arm to this shoulder to move those free radicals and toxins back down to the armpit. Also massaging these key muscles here, bicep and tricep, deltoid, and a little bit of the trapezius around the back, relaxing down. And then into that lovely forearm. Lovely bending those fingers with the tendons completely relaxed. That's good. Stimulating the lymph node in the armpit. And a nice stretch. Walking around the shoulder, stretching out. Into the wrist, seeing what it's telling me. Oh, it's not clicking like the right one. Oh, no, there's a click coming out now, but it's not as much. Yeah, that's good. And round the joint. And up the metacarpals. Seeing the circulation in the hand here flowing. Seeing the blood moving as I'm going over it in between those bones. And then rotating each digit, so around every knuckle of the thumb, a stretch, massage, rotation. A stretch and a flick. And into the palm, widening with 2 little fingers, and then over with thumb pads. Stretching. And then widening and moving up towards the heart, clearing the solar plexus of the centre of the palm. Reflex point. A stretch and a rest. Massaging into the shoulders and neck, oils soothing top point of the trapezius up the sternocleidomastoid, and a little stretch to start, and then round both shoulders symmetrically and under the occiput pull. Turning one way to bring some space into the right side of the trapezius length, pushing the shoulder down, heel of the hand into that corner, and then up the line of the sterno, pushing down again, and now knuckling, soothing that muscle, encouraging it to relax and release. That's quite tight. And then knuckling under the deltoid, stretching over the trapezius, that felt better. And then a good stretch over, which feels so nice to receive. And then pushing the other shoulder away, bringing the head down, just letting it go heavy. And again, that knuckling under the bone, over the trapezius, giving it some length, quite tight, and then up the neck, bringing the thumb at the back of the sterno, clearing it out. And need a little bit more trapezius work here, just balancing the shoulders. That's it, lovely. Bringing the head up onto the wrists and forearms while picking up the trapezius, top of the diamond. And soothing it out. Can feel a little sore, but in a sort of relieving kind of way, that all the pain, any tightness is dissipating, thereby bringing more flexibility and mobility to the area. Wonderful. And a nice neck stretch, bringing the head up, giving me the full weight of the head and neck. I've got you. Going as far down the spine as possible. soothing both sides of the head and resting it down in a nice long manner before repeating in a slightly different way, coming up, overlapping hands, and then fingers to the base of the occiput, allowing the head to go heavy, heavy, heavy. That's it. Heavy, tilting back, beautiful. In a beautiful neck release that I would normally do in core therapy, but just felt it was needed here. And a stretch. Applying oil to the skin that hasn't had any contact with oil so far, with those beautiful oils of frankincense, black pepper, and German chamomile, rosemary. Oh, and rosemary, thank you. Okay, letting the jaw go. Release, release, that's it, lovely. So the joint of the jaw, the TMJ back here, releases. It's soothing over the neck. Flat whole hands and coming up, up, up. And then the beautiful cheeks in a beautiful love heart manner, warming the area. Nice. And then up over the nose and the forehead. Soothing between the brows. The third eye is soothed and rested. And a face massage. And under the zygomatic, the cheekbone, to the temporal, over the mandible, the maxilla, the sphenoid, up over the frontal bone, and then the beautiful ears. Massage, rotation, stretch. It's at this point, normally with massage to the frontal bone, the ears and the scalp, that we may well be stimulated to see beautiful colours behind our closed eyelids. Back across the occiput, lifting the head to reach the full extent. lovely sagittal suture across the top. 2 thumb pads rotating in circles. And the rest of the sphenoid. And some beautiful scalp clearing, picking up the hair. And then a little bit of nail touching to the scalp. Clear and stimulate. And a little bit of pulling. Turning the head and pulling a little more to the back. So this has the effect of really connecting us far more than physically, so it's an emotional, mental and spiritual aspect. Now coming down the acupressure points, breathing and connecting with our essence. Three long effleurages up, very gently coming away. Keeping your eyes closed, taking a nice long breath. And continue with the deep breathing, sending your breath all around your body. And feeling the breath arrive at fingers and toes, and gently introducing a little movement to every digit. And then into ankles and wrists, and then rotating into shoulders. And if you feel like it, bringing your arms up over your head for a nice whole body stretch. And coming back into the room, opening your eyes when you're ready to, or maybe not.
Wow.
You feel good?
That was pretty special.
Oh,
Thank you.
absolute pleasure, my lovely friend Mandy. Pleasure.
Gosh. No, I was drifting and now it's
I think it's done you a lot of good.
I think so.
Yeah.
Yeah.
You might feel different afterwards.
Do you know, I was thinking that towards the end, I was thinking, I feel like a turning point.
Oh.
And just before you said about, when you were doing the ears, just before you said about the colours, I was thinking, oh, it's all pink and green and things.
Really?
Yeah.
You've made all my hairs go up.
Oh, it was like a new light. Yeah.
Oh, nice, isn't it?
Yeah,
Aren't
that
those
was
colours
really good.
beautiful?
And then you said that, I went, oh,
Wow,
no,
we were connected.
indeed.
Oh, you've got a tear.
I know.